Hi, everyone. My name is David Honey. I'm a registered nurse in the state of Oregon and also in the state of Washington, here in the United States. And I'm an assistant professor of nursing at one of the universities here in the United States. I want to talk to us a little bit about NCLEX RN exam. How do we ensure that we do NCLEX exam at once at 75 questions and we pass it without much trouble? And those are some of the things that I would like to talk to us about today. A little bit about my background. I moved into the United States about 5 years ago, wrote NCLEX RN exam about 4 years ago, and then I passed the exam. And so I will be sharing with us some series in the couple of weeks about how to pass exam. And we will be looking at both strategies to pass as well as understanding the content to pass the exam. So I will want you to join me on this journey by just subscribing to the videos that will be coming out in subsequent weeks. Like today, we just want to review some videos that focuses more on how to answer priority question in NCLEX RN exam. How do you answer priority-based questions? And I will be just treating about 3 topics. I want you to know a little bit that I'm an international nurse, and so I have international background. You don't have to be very smart. You just have to know what to do to be able to pass and succeed. So join me today. Today we'll just be reviewing some priority-based questions that are based around cardiac-related patients. And to answer priority-based questions, there are things that I think we need to know about. But let's practice with 1 or 2 questions. For instance, when administering a thrombolytic drug to the client who is experiencing a myocardial infarction, who has premature ventricular contraction, which is expected outcome of the drug? When we look at this question, it's giving us a background information about the administration of a thrombolytic drug to a client who is experiencing a myocardial infarction. So what is the question? The question is asking about the expected outcome of a thrombolytic drug. A, to promote hydration. B, to dissolve clot. C, prevent kidney failure. And D, to treat dysrhythmias. When we look at those 4 options, we will see that a thrombolytic medication is a medication that is actually given to patients after an event of myocardial infarction or after an event of pulmonary emboli. The purpose of the thrombolytic, when you look at what lytic means to break down. The word lytic means break down. So, to dissolve. So, when you see things like that, thrombolytic are medications that are given to dissolve thrombus. Thrombus is a blood clot. The blood clot in the vascular system. So, thrombolytic medication is to dissolve clot. So, we look at B. When we look at A, and I told us before in the former series, you don't want to start by picking the right answer. You want to start by eliminating wrong option. 1, promote hydration. Thrombolytics are not meant to promote hydration. Then 2, to treat dysrhythmias, which is abnormal contraction, irregular contraction of the heart. Medication like thrombolytic medication are not meant to really treat dysrhythmias. So D is not the option. So the answer here is B, to dissolve blood clot. And let's look a little bit at the rationale behind picking B. Thrombolytic drugs such as TPH activists are administered within 6 hours after the onset of myocardial infarction to break down the clot and to reduce the onset of myocardial damage. You give this kind of medication to break the clot and to reduce the onset of myocardial damage. Another medication you want to think about here is warfarin. Warfarin is an anticoagulant. It is never a thrombolytic. The purpose of warfarin is to prevent blood clot. But thrombolytics are medication that are given to break down blood clot so that patient will not suffer devastating consequence as a result of thrombosis. So, looking at this question, the answer is B. Let's look at another question here. A patient with heart failure is taking furosemide, digoxin, and potassium chloride. The patient has nausea, blood vision, headache, and weakness. The nurse notes that the client is confused. The telemetry strips shows first-degree atrioventricular block. What other sign should the nurse assess first? Anytime you see the answer, the question that put first is a priority question. It means that some other option in the answer may be correct, but what will you do first? What is the most correct option? That is what this kind of question will be asking you. What is the best option? What is the most correct? In some instances, you will not see the word first. You may see most important. So I want you to take attention to words like first, most important, best, because those questions that are designed in that way are priority-based questions. So how do you answer this question? A patient is taking furosemide, digoxin, and potassium chloride, and you're beginning to see that the patient has nausea, blood vision, headache, and weakness. So I want you to ask yourself, will hyperkalemia cause nausea, headache, and weakness? Possibly no. Pulmonary edema will not at least cause headache. So I am going to eliminate option A because hyperkalemia, too much of potassium in the blood, will not cause headache. And pulmonary edema will equally not cause headache. A patient that has pulmonary edema will have difficulty in breathing and difficulty in sleeping. And so therefore, and the patient that has pulmonary edema will have a lot of cough. So, pulmonary edema will not make a patient to develop blood vision or headache. So therefore, I am eliminating pulmonary edema. I am leaving digoxin toxicity and fluid deficit. When you look at this patient, the patient has nausea, blood vision, headache, and weakness. Digoxin is one of the medications that have a low therapeutic index. It means the chances of developing toxicity with digoxin is very high. The chances of developing toxicity with digoxin is very high. And signs and symptoms of digoxin toxicity are headache, nausea, blood vision, vomiting are some of the major signs and symptoms of digoxin toxicity. So in this case, what is most important answer is B, digoxin toxicity, not hyperkalemia. Let's quickly run through the rationale behind picking B. Early symptoms of digoxin toxicity include anorexia, nausea, vomiting. A patient experiencing digoxin toxicity may also experience visual disturbances, can also occur blood vision, double vision, and what is called visual halos. The patient may begin to see some colors, abnormal color, because of digoxin toxicity. So hyperkalemia is a common cause. Hyperkalemia is a common cause of digoxin toxicity associated with arrhythmias because of low serum potassium can enhance ectopic pacemaker activity. Although vomiting can lead to fluid deficit, given the client history, vomiting is likely due to the adverse effect of digoxin toxicity. Pulmonary edema, like I've said, is manifested by dyspnea and coughing. Therefore, the answer in this case is digoxin toxicity. Let this be a kind of a takeaway that in digoxin toxicity, you see blood vision. In digoxin toxicity, you see nausea. In digoxin toxicity, you see vomiting. Those are the major signs of digoxin toxicity. Pulmonary edema, you have a lot of coughing and a lot of dyspnea in pulmonary edema. So the answer here is B, digoxin toxicity. The last question for today is, an adult come to the emergency department with a crushing substandard chest pain that radiates to the shoulder and to the left hand. The admitted diagnosis is acute myocardial infarction. Prescription include oxygen, binasal cannula at 4 liters per minute, complete blood count, a chest radiography, and a 12-lead electrocardiogram, ECG, a 30 milligram of morphine sulfate. What should the nurse do first? This question is saying, there's a patient that walked in, diagnosis of myocardial infarction, couple of prescription, test, electrocardiograph, complete blood count, and chest radiography, which are normal to do. With 3 milligram of morphine sulfate IV, what will you do first? This is another example of a priority question with the word, what will you do first? A, administer morphine. B, obtain a 12-lead ECG. C, obtain the blood work. D, prescribe chest radiography. When you look at all this answer, this is intervention. A is intervention. You are actually doing something to reduce the pain of the patient and to attend to the need of the patient. B is an assessment option. You are doing 12-lead ECG to actually find out about the condition of the heart. C, you are obtaining a blood work to find out the extent of the damage. Maybe you are going to see something like troponin in the blood or something that could suggest the heart is failing. Example of that is troponin enzymes in the blood. D, prescribed chest radiography. This is an assessment option. You want to find out what is going on with the heart. You also want to find out with option C what is going on in the heart. With chest radiography, you also want to find out. So the only option that can actually, that is interventional based, is A, administering morphine. Remember, I told us that in NCLEX RN exam, chest pain is treated as an emergency. Any major chest pain is an emergency. And always remember that in the case of an emergency, intervention takes priority over assessment. In case of emergency, intervention takes priority over assessment. So what you want to do in this case is to think of intervention, which is to administer morphine. It takes priority over B. It takes priority over obtaining blood work. It takes priority over chest radiography because these are all assessment. But because this is an emergency with substandard chest pain, intervention must be prioritized over assessment. Let's look at the rationale. Although obtaining ECG, chest radiography, and blood work are all important, a nurse priority action should be to relieve the crushing pain of the chest. Therefore, administration of morphine is a priority action. In chest pain, it's an emergency, and giving morphine to the patient will relax the patient, will cause vasodilation of the blood vessels around the heart, and will extremely reduce the pain and the anxiety that the patient have. So in this case, administration of morphine will be the first thing that you are going to do as a registered nurse. On this note, we're going to close today, but I want to encourage you to subscribe to the channel. I will keep posting and I will keep doing reviews on priority for the next couple of weeks. How do you answer priority question, and how do you know what to pick first? And so we'll be looking at this in a couple of weeks, and I want to thank you again for joining the channel. The next thing we are going to do is that how do you answer select all the apply question. So my next video will be based on that. How do you answer select the apply question? Feel free to drop your comment, drop your questions, and I look forward to meeting with you next time. Thank you very much, and I see you again.